Hello, and welcome to our first recorded episode of a podcast where we can't remember the name
Why is this the first?
because we'll
Why?
get it because of the first podcast where you can see us.
Oh, is it?
Yeah,
Yeah, we've phoned it before, but never done anything with it.
yeah.
Yeah.
As is our way.
Yes. There are probably many, many podcast episodes that have happened,
Yeah.
as far as we're concerned.
Yeah.
But for the listener, they don't exist.
There's many things. There's many things in this company. We had a whole subscription box service going at one point, guys.
Jeez. Oh.
We had planned, we had bought an entire subscription box, pregnancy subscription box, decided what each month was going to be, and then just didn't do it.
Because it wasn't worth it.
It wasn't worth it.
It wasn't worth our time.
It wasn't going to work
And
well.
you know when you're really, really hungry and you overorder?
Yeah, that's us.
That's us with work.
Yeah.
We're like, oh, we've got this idea, or we could easily do that.
Yeah.
And then it comes to actually fitting that into our lives, and we're like, oh my God, I'm drowning with just the basic stuff I have to do. So yes, that's why we're getting better at that.
We are definitely getting better at that. I feel like recently our catchphrase has been like,
Let's be realistic.
let's be realistically
The word of 2023, I think.
which is good for us.
Yeah. Because realistically, we will have fucking breakdowns if we don't be realistic. We're so close anyway. I am. I'm so close right now.
I'm all right at the moment, but I'm at the good part of my cycle. So
Right. I reckon next week is going to be so bad.
oh god. Oh, well, I look forward to this.
I am.
Next week's podcast is going to be on birthright. So get ready for the rage.
Oh God. But next week's podcast could be on the emotions of pregnancy, and I'll just cry along with you all, and you'll be like, "Yeah, I feel you." Because yeah, this week is bad because Silas isn't sleeping off the back of his cold. He's also, I think he's got some teeth coming. He's kind of learning new stuff.
He's won.
They're
They're like
pricks.
this at one, aren't they?
And yeah, so next week, if he hasn't got better with that and I'm almost due on, fucking God help you all. God help you all. I
Mainly
will
me,
be,
because I've got to be in a fucking room with her.
mainly you and my children. But, do you know, I'm realistic about that as well.
Realistic.
I'll be getting takeaways next week. I'll be
What?
staying indoors, and I will be taking myself off when I want to kill people.
Yeah.
So, let's be realistic.
Amazing.
But
Amazing.
welcome to this sunny,
Welcome.
lovely podcast.
Welcome. Hope your pregnancy is going well.
Hope you're cheery today.
The turning weather probably hasn't helped.
No, fucking nothing's helping, mate.
Nothing's helping. Oh God, full on mental breakdown over here. She's fine. She's
I'm
fine.
totally fine. I just need a bit of sleep. That's
She's
all.
been worse.
Yeah, I have been worse. I was worse probably 3 weeks ago. But yes, we have come to talk your ear off about risk today. Because there's a massive focus on risk during pregnancy and for birth, and I can't do that because I'm high risk. And I do think that sometimes people wear high risk as a label.
Yeah.
And I don't mean that to sound horrible, but we live in a society where it's like, it's almost an interesting thing about you if you've got something wrong with you, or if things feel a little complicated. I hear it all the time. Just even on the school run, I'll hear people be like, yeah, well, I'm consultant led. Yeah, well, my consultant says I won't be able to. Well, your consultant is actually not in charge, but I think people sometimes like to be given guidance by someone else.
And I think there is a portion of society that don't want to have to make their own decisions for themselves. I get that.
Yeah.
I would love somebody to make all my decisions for my life for me.
Yeah.
But they're not always going to be good decisions that
No,
are made.
and I'm going to have to live with them.
Yeah.
And I think I totally get it. It's like people get more informed, don't they? And then it opens up so many more questions than it solves.
Yeah.
And people then, it's easier to think that person's an expert. Why would they tell me something that's not the best for me? Or, I've been told that I can't birth there and I've got to birth there, so I don't have to make that decision anymore.
Yeah.
But actually, you always have to make the decisions because you can be the only person who can manage your risk and what you're happy with.
I think that's something that's worth starting to talk about, is that risk is different for everyone.
Absolutely.
And the way you feel about that risk is different for everyone. There is a risk to everything you do. Everything has a risk and everything has a benefit. There is a risk to stepping out your house every morning. There's a benefit to stepping out your house every
It's
morning.
great to get a bit of fresh air, see the community, feel busy, maybe see your pals.
That's good for your hormones. That's good for your well-being. But there is a risk you could get hit by a car.
Yeah, a branch could fall down on you. You could be caught in some sort of street altercation.
But as human beings, as adults especially, we don't expect children to balance this risk. They're not quite there yet. But as adults, what we have the ability and we should be doing is looking at that and going, okay, well, there is a risk to doing this, but does the benefit outweigh the risk for me personally? Now, for me personally, I would rather risk leaving my house and having a good time. Alex wouldn't, but not because she's worried about the risk of being outside, just because she doesn't want to.
I just don't want to see anyone.
But I would rather take that risk and go outside and go somewhere or do something, knowing that XYZ could potentially happen. And when we convert this and now look at this as in pregnancy, absolutely everything you do has a benefit and a risk. We recently posted when somebody asked us about what is, I've been told that I have to be induced when I go overdue. Is this true? It is not true, and we had an obstetrician tag us in something, which we ignored, and if you're listening to this, fuck you.
No, we don't owe you a response to everything. If we had to respond to all the DMs we got, that's all we do.
But this obstetrician was quite angry that we had essentially said that it isn't evidence-based that everybody should be induced because of their due date, and this is true, because even though there is a small increase in potentially something happening, going wrong after 42 weeks, that still doesn't mean that every single person should be induced at, let's face it, nobody's getting to that 42-week mark anymore, really. At 41 weeks, because just in case there's a 0.0 something % chance that something could happen after 42 weeks. For some of us, we will look at that chance and go, there's no way I'm going past 42 weeks. For me, that risk is too big. And for some of us, we'll be going, the benefit of my baby staying in and me not having that induction is higher for me, and therefore I will be staying pregnant for as long as possible. We have to look at this ourselves and take responsibility for our own risks and realise that everyone's different. So you shouldn't be doing what Sharon down the road does.
No, and it's important to look at it in all the different ways as well. Like, it's one thing to see a research study that says 0.0 point something, can't even speak, a minuscule percentage. And it's another thing entirely to be being told by a midwife, you can't go over 42 weeks because your placenta will start to deteriorate. That is categorically not true. Mm-hmm. And what I will say on that is that if something happens to a baby or something appears to fail with the placenta at 42 weeks, we go, placenta, because you were 42 weeks. Yeah. If that same thing happens at 37 weeks to someone, no one blames it on the gestation.
Nope.
These things do happen. The chance of them happening is minuscule, but it's not related to your week of pregnancy. And that it has been debunked. The placenta is a fetal organ. And if your baby's not deteriorating, why would your placenta be?
Yeah, absolutely.
If your placenta is able to get all the proper blood flow and, you are well in yourself, there's no reason to think that your body's thinking, oh, I'm 42 weeks now. We'll stop prioritising that thing because clearly it's not needed anymore.
And we've got to remember as well that due dates are bollocks.
Total bollocks.
You might be 42 weeks, but actually you're 40 weeks. And we can't know this. So actually all of it is absolute rubbish when we look at this. But this is the thing. For that obstetrician, she had cherry-picked information. I think she'd got it also from ARCOG, which I would never get any information from ARCOG. Not good evidence. And if you want to know a little bit more about how the maternity system works and learn a little bit kind of about how they rate their research and evidence, have a listen to the podcast we did with Anna from Hackney Hypnobirthing.
Yes, and I think just for the purpose of this podcast, I think it's something like 13% of the ARCOG guidelines are based on good quality evidence.
Yeah, so what about the other lot?
87%. Yeah. 87% picked out and fuck all.
Yeah. So
just evidence they could bandy together.
Yeah. And this is the thing as well. All of us can find research and evidence to back up our own opinion.
Yeah.
We absolutely can. If I wanted to find evidence on something and make it sound like I wanted it to sound, I 100% could. But this is the reason why we always direct people when looking at their own risk and their own factors to places like Sarah Wickham.
Yep.
Places like Midwife Thinking, Dr. Rachel Reed is
Evidence-based
wonderful.
birth.
Evidence-based birth.
That's a great place if you're into research studies to
Yeah.
really look at the nuances between them, because I think evidence-based birth does a really great job of actually discussing this study found this study found this. And when we get to the end, let's look at what all those studies together have told us, and it probably means this.
Yeah, absolutely. And I think these are great places to go and find out your own risk and to realise that, yeah, risk is personal because of our past and our stories and everything we've been told. And I also think, like Alex was saying as well, about the high risk, if you're high risk and low risk, but you know, there's no middle risk. There's no just normal risk.
So you could tick 3 boxes and you're low risk, but as soon as you tick a 4th box, apparently you're high risk.
And it's
high
all
risk of what?
Yeah. And it's all in the computer system as well. There's no looking into personal
She ticks these
circumstances.
boxes, but actually she's healthy as fuck.
Yeah.
Yeah.
It's,
You know, her BMI is high because she's a weightlifter and she's short.
she's a fucking good.
She's a beast.
Yeah. She's an Amazon.
Do you know what I mean? Like, you know, see people and you just think, how are you labelled as high risk? And now that's caused a load of extra worry for you, because you now feel like your body's less capable of birthing a baby than someone else, and you're being made to feel that way in your appointments.
Yeah.
You've now got the stress of like extra input from consultants and stuff, and take away the actual appointment, having to think about getting yourself to the hospital for those
Yeah.
extra appointments, sitting in the waiting room, having that impact on your day, that's all stress that you don't need in pregnancy. Now, obviously, consultants can offer us lots of extra information.
Yeah, because some people
support,
genuinely are high risk.
and those people should get the information from a consultant should they
Yeah.
want it. But so many people are just being labelled high risk and offered, well, I say offered, sent to consultants
Yeah.
when actually it's not what they want, it's not necessarily what they need. And it's important to know that if you feel like you're not getting anything out of your consultant appointments, or you just don't really fancy it, you feel like actually, yeah, I'm a short weightlifter, of course my BMI's high, then you can actually decline consultant-led care. And that's not a risky thing to do either.
No, it's not. And there is a risk to it.
Oh, sure.
And because there's a risk to everything, but you take that risk on and look at what it actually is. And I also think it's really important to realise that being low risk nowadays, we call it the unicorn. Because it seems the parameters for what is, well, essentially everything are becoming wide or short, or depending on basically what it is, in that if you are deemed low risk, you are lucky. It feels like, and I'm sure this isn't the case, but they are trying to make people high risk.
Well, I was just thinking, like, I believe we've both been low risk, haven't we? But if you had another baby, which you won't, thank God,
thank fuck for that.
you'd probably not be anymore because you had a big baby last time. He's fine.
It's fine. It was absolutely
He's born
fine.
at home.
Yeah.
But he was big, so we got to probably send you for extra scans
And they
stuff
did
like that.
try very much with me, like down, because he was big from the start. I measured big from the start. I always did. I was measured by the same midwife every time, and it was always huge. Actually, on scans, he measured normal, like a medium size.
She was not.
She was not, and continues to not be. But so the scan was wrong. But there was definitely, we need to send you for GD testing. And this wasn't my midwife because I went privately, but whenever I had anything within the NHS, there was always a push to try and get me to like be something. And I'm a very informed individual, but I was spoken to so horribly by somebody that it really sent me in like an anxiety-filled path, because it just, end of pregnancy, you feel shit anyway.
It makes you question, like, what you actually know.
Yeah.
Even though you know it, you deeply know it.
Yeah.
But you get to that point and you're like, oh, God.
And this is why I
because
feel
what if
for people that aren't me, surrounded by birth experts, with also all this knowledge that I have of my own, that one obstetrician can throw you off a path, demand that you come in on a Saturday because you're desperately needed to be seen, and then I just didn't turn up to the appointment. But that sent me on a really panicked, probably a week or so before he was due. I was just in a state of anxiety the entire time.
probably why he wasn't born on his due date.
Yeah.
He had to wait till the next day.
I know, outrageous. Fucking going overdue. What is this?
And how many babies is it that suddenly you're high risk, even though you've been popping
sure
out
it's free.
babies? Is it? Right.
I'm
So
sure.
if I were to have another one, I'd
Yeah.
also
Don't.
then you've had no, I fucking won't. Seriously, this week is not the time to be talking to me about that, okay? Don't talk to me about that being a possibility. But no, like when we talk about risk, it's so there's a risk of this happening, there's a risk of this happening. Okay, well let's reframe that and make it chance. There's this
Yes.
chance of this happening. And what that means is if there's a 1% chance of something happening, there's a 99% chance of it not happening.
Take them odds on the lottery, wouldn't
I
you?
fucking would, yeah.
Yes,
Take all
please.
my money.
Never hear. You won't hear from us again, you bunch of bastards.
We don't do this for fun. No, I'm only joking. We actually do this
Yes.
from the kindness of our hearts for fun. But the thing is, like, yes, okay, so you've got a 99% chance of it not happening. This is this made up statistic. So say you want to have a home birth or you want to have a water birth and you just are thinking you want things to be kind of hands off. You've had this idea in your head about how your birth will look, how it will feel, and that's what you want to go for. And you are being advised to go against what you want and plan for a different type of birth or a different location, all because of this 1% chance of something happening. Now, if that's what you want to go with, that's fine.
Yeah.
But what about all the benefits of cracking on with your plan, knowing that actually there's a 99% chance that it'll go well? So maybe you want to have a home birth. The benefits of that might be that your labour is more comfortable, that you can have as many birth partners there as you want, that you've got your home comforts, that you're more likely to have an unassisted birth, that
Lower
everything
chance of
is
PPH at home.
yeah, much lower chance of postpartum hemorrhage. And instead of all that loveliness that contributed to your decision to want to have that home birth in the first place, you're now swapping that out for, say, a hospital or a birth centre that may then increase your odds of things like postpartum hemorrhage, pain,
Statistically does increase your odds
yeah.
of all these things.
interventions that you didn't want, more pain relief, surgical birth,
Yeah.
all of that, all to avoid that 1%.
Yeah.
It's just ludicrous.
It is.
And we obviously understand how ludicrous it is because we see it in day in, day out. I know that for a lot of people that are pregnant, they are just thinking, but why would they advise that if it wasn't what was best for me? And really, it's because the guidelines say to advise you of that. And if they don't, you
They
could
get in
sue.
trouble. Yeah.
You could sue them. That would cost them a lot of money. And maternity service is the highest litigated part of the NHS. Almost quite rightly so.
Yeah.
Because people want to put a blame on these things. And unfortunately, sometimes there's no one to blame.
No.
Because I think it makes people uncomfortable. And I suppose it's worth bringing up on the Risk podcast. People want to believe that you can prevent these things when actually most times there's an adverse outcome, such as a stillbirth or a baby who is perhaps born and needs an ICU. Most times no one had any idea.
No. Nothing.
There weren't risk
blame.
factors.
Yeah.
There was no sign of this happening. It just happened. And sometimes bad things happen. And I think as humans, we want to reduce that risk to nothing. And there's nothing we can do to make that
Especially as
risk nothing.
parents.
Yeah.
And I think that's the thing as parents, we're looking for, right, so there's a 1% chance, right, well, I won't do that then. But we negate the fact that actually there are other chances of other stuff. There are always risks, even when you take the path that you are being told is
Yeah.
the less risky. But there are risks to...
Hasn't reduced your risk to zero.
No, there are risks to inductions, there's risks to cesareans, there's risks to home births, there's risks to everything. There's benefits to all these things as well, but often we aren't told the risks of the things that are suggested to us. And that is what I have a problem with when it comes to that, is the fact that you're told, right, your baby, let's go with big baby, your baby's big, so you've got X chance of this happening and shoulder dystocia, so we would want you in the delivery suite because...
Let's induce you earlier.
Yeah, induce you
Okay.
earlier. We want to make sure, we want to monitor baby as well, so we'll have you laid down and all of this stuff. And you're like, okay, so this is shoulder dystocia, I'm really worried about that now.
Okay, so
But, okay.
induction increases your risk of shoulder dystocia.
Yeah,
Lying on your back.
monitoring.
Monitoring is
Yeah.
going to increase your risk of surgical birth,
Yeah.
of interventions.
But you're not told about that. And if they said to you that, would that then make you go, okay, well, what are the benefits to doing it the way I was going to do it? Well, actually, the benefits to being upright,
You're less likely
and
to have
you're less likely to have
shoulder
shoulder
dystocia, you're less likely to have
Yeah.
anything at all.
And what about intermittent monitoring? Yeah, you're less likely to have a surgical
Yeah,
birth.
and that's
actually
just as safe as-
And the research shows us that actually you are just as safe to. There's no real difference between it actually,
No,
other
in
than
terms of safety.
Yeah, in terms of safety, other than continuous monitoring means that we pick stuff up that wasn't actually a problem in the first place. Like I like to use the example of that is if every single one of us was to have a full body scan, we would find anomalies that wouldn't ever cause us a problem. But we would
might
have to then
do
have
stuff.
them checked out
Yeah.
to see. And
We'd
then
maybe
that,
have biopsies
Yeah.
or we'd take medication to reduce whatever it was. And maybe that was never going to impact anything.
For some people, it would save their lives doing that.
Yeah.
But how many people would have to go and have that and then have to go through all these tests for those people to save it? And as much as that may sound, like, oh, we should all do it to save these few people, that's not how the world works.
No,
And
of
that's
course
not
it's
it.
not. And that we wouldn't all get that on the NHS either.
No,
'cause
exactly.
They could not
And
afford to
so
do that.
This is the thing with the intermittent monitoring is that it's just as good as continuous monitoring, if not better. But we won't be told that. So all of this stuff happens and we get, told all these things that we should do to prevent this. But we're not actually told that the risks that actually increases it.
And continuous monitoring as well. When it comes to like being able to report anything, if something does happen, you've got hard evidence there. You've got a printout of the monitoring that you were looking at. There's no human error. That was the printout. Me and my colleagues all looked at it and we all agreed that baby was fine.
Yeah.
So whatever happened to that baby, it's not on us.
Yeah.
And that's really sad that our healthcare professionals have to operate that way, that our systems have to
Yeah.
operate that way. But unfortunately, when it comes to the NHS, it is cheaper to offer things that perhaps do increase risk of some things than it is to pay out for people who sue when you didn't do something and something adverse happened.
Yeah, and it's really hard when you're pregnant to navigate all this.
Really is.
It's so difficult and we really, really get it. But the thing that we want you to do, those of you that are listening, that are pregnant, is to look into everything, look into the benefits, look into the risks, and you decide for you what is right.
Yeah.
That is what is important. And your stories, what's happened in your life will help you decide that and help you decide what is the most important thing for you. But just remember, just because you're advised that, for the big baby thing, that you need to be in hospital and be on your back to be monitored, question everything. Question everything.
And when we think about risk, just because something's risky to you, don't judge someone else who's weighed up their own risk, because often we will talk really disparagingly about people who perhaps have been advised against a home birth and still plan one, or have been advised to have a cesarean but would rather go into spontaneous labour and have a vaginal birth. Now, these people are not idiots who are like wooden-headed and they're not going to change their plan. They've just weighed up their risk and they've decided that feels okay to them. And actually, all those benefits that we spoke about of going with what it is that they want outweigh any risk for them.
Yeah.
And like when we talk about stories, some people, potentially it's been a really long road to get pregnant, or maybe there's
100%.
been multiple losses, and those people we find are often more risk averse. Not always. Some of them are very much like, this is my chance.
Yeah, this is my
and
time.
I'm doing it how I want to do it. And that's lovely. And other people are like, I haven't trusted my body up until this point because it's been so hard to become pregnant, to stay pregnant. And so I just have not got that trust. And I am going to go with whatever, because clearly I can't be trusted.
Yeah.
And other people, maybe there's a friendship group where there's been a load of inductions that have ended in emergency C-sections, postpartum hemorrhages, postnatal depression. And we have a lot of people come to our classes who will say things like, God, a load of my friends have had inductions and ended up in cesarean. I am not having an induction.
Yeah.
They're like, I will pick a point at the end of pregnancy where if I haven't gone into labour at that point, I will opt for a planned cesarean, because that feels more like something that I feel comfortable with than the unknown of potentially spending days being induced. And that's fine too. That person is not stubborn or dangerous or not caring about their baby for not going along with what is like the status quo.
Yeah.
We also have to think as well, people are almost blind. Like, obviously there's our instinct. It's a really powerful tool to tell us that our baby is well. However, when you can't see your baby
It's really
and you
hard.
haven't trusted your instinct
Yeah.
for your entire life, it is really hard to really truly believe that actually if something was up, you'd probably be the first person to
Yeah.
know. And it's really easy after that baby is born and that experience wasn't what you wanted to look back and think, my baby's fine. I shouldn't have picked that.
Yeah.
I shouldn't have gone along with that. I should have fought harder. And it's
Yeah.
really easy to beat yourself up because you've now got the benefit of hindsight. You're now looking at that baby and you know they're perfect and that they're
Yeah.
healthy and that your body was keeping them safe all that time.
And I think that it's worth saying as well that if you feel like that, you made decisions with the information that you were presented with by
Yeah.
people that we are meant to believe would only tell us what is best for us.
Yeah.
And that's a hard thing to realise, is that healthcare professionals, they are amazing, a lot of them, and we are not healthcare professional bashing. I hate that we have to caveat everything with that, and we're not. But a lot of healthcare professionals are incredible and they will want you to make your own decisions and do, all of this stuff. But then a lot of healthcare professionals really are just watching their own back.
They are, unfortunately, because you come in for your appointments, you're going to have your baby, that's great. The people they work with in, day out are perhaps talking about them behind their back.
Yeah.
Saying what a nightmare you are for the extra paperwork you cause by supporting these people to go against the
Yeah.
guidelines. And were you clear with that person about the risks? Did you tell them their baby could die? Well, no, I fucking didn't tell them that
Yeah.
because that's cruelty. But it's like there becomes a culture where you're either in or you're out,
Yeah.
essentially. You're either doing what we're all doing and you're kind of sticking with us, or you're being a pain in the arse.
Yeah.
And not everyone is ready to be that pain in the arse at work. Many are.
I would
Met
be.
fantastic midwives that are just like, oh yeah, they want me to give you this, but
Yeah.
don't worry about it.
Many incredible people like that. And I think that's worth also saying, is that if you find yourself butting heads and really struggling and being
Yeah, and the
not...
focus is all on that risk.
Yeah, ask for another person.
Yeah.
You are paying for this service. The NHS is not free.
Yeah.
And I fucking hate that's how we feel. And we're so grateful for the NHS. And yes.
Oh, that tax you pay.
Yeah.
Yeah, that's what that's for.
I mean,
Well, and the
and
war.
Boris's...
And the wallpaper.
Wallpaper.
And, number 10, yeah. Couple of parties.
Yeah, absolutely.
Got to get the best wine for the old party gate.
Fucking hell. But yeah, basically what I would like you to take from this podcast is that you need to take the responsibility
Yeah.
for yourself and decide what is right or wrong for you, and let people know.
Yeah, and if you are advised to do something or you're advised against something and you're thinking, I really don't want to do that, does that make me selfish? No. The fact that you really don't want to do it is a sign that your instinct is telling you that all is well and that actually you can make that decision. And that's fine, because actually sometimes we're offered things and it feels like a relief, like your instinct is telling you that that's a good idea and that you're happy to go along with that. And other times we're offered things and we think, oh, bloody hell, that's a bit pasty. I don't fancy that at all. And that's not you like, oh gosh, I didn't want to have a cesarean and now I feel like just because I've got a fear of that, I'm being selfish for my baby. Well, maybe you don't need a cesarean.
Yeah.
And I bet that should it come down to it and you felt at any point that a cesarean was right for your baby,
You'd have
you'd
it.
be straight in
Yeah.
there. You'd be cool as a cucumber and
Yeah.
you'd be doing what your baby needs.
Yeah.
And the fact that you don't feel that that's what your baby needs is really powerful feeling.
It really is. And I think on that note,
Yeah, you do you, mate. God.